All right, guys, here is the 2020 version of the ABCs of Medicare. The way that I go over with my clients so that they understand all of the options they have with Medicare. So I'm just going to jump right into it. There's really four main options. The first one is A and B. A is your hospitals, B is your doctors. A, they automatically enroll you in when you turn 65 or when you've been on disability for 2 years. And as long as you've worked 40 quarters or 10 years, Part A will be free. And then Part B, the standard cost for Part B is $144.60. Here's the coverage you have if you just have A and B. With Part A, you have a $1,408 deductible that covers the first 60 days that you're in the hospital. And then with Part B, you have a $198 deductible, and then Medicare pays 80%, and then you pay 20%, and that is uncapped. So that's original Medicare. So if a beneficiary only has the red, white, and blue card, that is what they have. Second option, they can do A and B and a drug plan. Still the same coverage at the doctor and the hospital. With Part A, $1,400 when they walk in the front door, covers the first 60 days. Then with Part B, when they go to any outpatient facility or an emergency room, they have a $198 deductible, and then they pay 20% till whenever. But at least in the second option, they have a drug plan. All of the drug plans are state specific, and they usually range anywhere from $10 to $15 to as much as $90 or even $100. But even if a beneficiary isn't taking any medication, it's still a good idea to get a prescription drug plan, because for every month they go without, they incur a 1% penalty till they finally pick it up. But in both of the first two scenarios, the real issue is 20% till whenever. There is no cap on what their expenses will be for Part B costs. So most of the folks I talk to end up in one of the last two scenarios. So in the third one, you have A and B and a supplement and a drug plan. So in this scenario, what happens is the provider will bill Medicare, whether it be Part A or B, and then they'll send whatever's remaining to the supplement. The most common supplement sold is Plan G, because it's super easy to understand. Once they pay that $198 Part B deductible, then they will not get a bill as long as Medicare pays. So as long as Medicare pays, the supplement pays. And there's really only two main differences in Medicare supplements: the name on the card and the price you pay. So it doesn't matter if we get Plan G from Aetna or United or Blue Cross or Cigna or Humana, they're all going to pay exactly the same. And with that being said, their network still remains anybody that accepts Medicare, because as long as they accept Medicare, they're going to accept the supplement. One thing to keep in mind with the supplements, they are private insurance. So the first 6 months after you go on to Medicare, or the first 6 months after you turn 65, they are guaranteed issue, which means they will not ask any medical questions. So once we get outside of that window, and unless you have some other special circumstance, you will be subject to answering medical questions. Once they're in the door, they can't kick you out, but if you try to come in past your window, they can ask you questions. And what does it mean when insurance companies ask you questions? Usually there's a couple of scenarios that play out. They say, hey, you're super healthy and you get our best possible rate. Hey, you're not as healthy, so we're going to let you in, but you got to pay a little bit more. Or they're going to say, hey, we don't like this risk. We're not going to insure you at all. Now, even with this scenario, that the Medicare supplement only covers what Medicare doesn't pay at the doctor and the hospital. So you'd actually still need a separate standalone prescription drug plan. So if you have a Medicare supplement, you'd still need a drug plan, and that beneficiary would end up with 3 cards in their wallet, because they'd have their Medicare card and their supplement card they'd show the doctor in the hospital, and then they'd have a separate standalone prescription drug card they're going to show at the pharmacy. So that's one option. And then the last option is C, which is a Medicare Advantage plan. And really the correct way to write this would be to put A and B in parentheses, because you're still paying for your Part B. But what you've done is you've assigned your Medicare to a private insurance company to manage. Sometimes these are called Part C, Medicare Advantage, Medicare replacement plans. These are all county specific. So what happens is you assign your Medicare to this private insurance company to manage, and they're making a couple of agreements. Number one, they're going to cover all of the same things that original Medicare covers. That falls into a couple different things. They have to provide all of the same services, and they have to do it in at least that 80/20 coinsurance scenario. So that means that Medicare covers hospice and inpatient and outpatient. Well, Medicare Advantage covers all of those same things. And then the other part of what a Medicare Advantage plan will do is it will put the beneficiary's cap on their expenses. So they may say once they reach $3, $4, $5, $6, $7,000, then they're going to cover 100% after that. Now, these Medicare Advantage plans, because they're getting a check every month from Medicare to manage that Medicare, and then whatever the beneficiary pays in copays, they're going to be able to keep whatever's left over. So what they will do is they will reinvest that back into the plan, and what you'll see is them adding additional benefits above and beyond original Medicare. Free dental, free vision, free hearing, gym memberships, over the counter. So if someone is seen as talking about those services, it's probably an advertisement for a Medicare Advantage plan. So those are all county specific. And that, to me, is the way that I would review the ABCs of Medicare with someone. Thank you.